So she was referred to us via one of our paediatricians in Kemeladwan, and they referred her to us because essentially she requires emergency evacuation. For them, it's a typical case, which is hugely frustrating because they're actually saying this child shouldn't be getting evacuated. They should be able to be treated in country, in their homeland, around everything that's familiar to them, notwithstanding the fact that it's a complete war zone and it's the most dangerous place on earth for children. But, they want to see Gaza being rebuilt. And as this horror has continued, and as we've seen, the progressive decimation of the medical infrastructure there, she's been less able to access medications, less able to access specialist treatment, less able to access dialysis. She has end-stage renal disease from polycystic kidney disease, and now needs a permacath insertion, which is the only way of keeping her stable. And we have an MDT team of pediatric specialists and subspecialists, including nephrologists and the clinicians required to support Jury's care. And they meet weekly, multiple times a week, and discuss cases like Jury's for hours at a time. And they have unanimously said that this child needs super priority evacuation, without which she will die. I mean, I'm quoting that from the file. There is our medics, both in Gaza, who are paediatricians with specialty in kidney disease, and our renal failure specialists out of country, have said this child just needs to have regular access to dialysis and also the potential of having a kidney transplant. Now, if she has a kidney transplant, that would hopefully solve many of the issues that she has. But even if she has a kidney transplant, what we do also need to emphasize is that there needs to be sufficient medical resource delivered into Gaza at scale and at the right pace, so that children like her can access dialysis when it's required, can access the diagnostic tool, and can access the medications that will keep her stable post-transplant. No child should have to be removed from their homeland and all that's familiar to them because they can't access dialysis or, medication that keeps a child with a chronic condition well and stable.